all. Today I'm going to talk a little bit about the benefits of vitamin D. So we do know that it's helpful for bone integrity. It helps with calcium uptake into your bones. It's helpful for brain function, for muscle protein synthesis, otherwise building muscle. It's also helpful for inflammation, so after or recovering from soft tissue injury, it's helpful for that. And immune function. And in particular, it's helpful for decreasing upper respiratory illnesses. So segue into COVID-19. And I'm sure you've seen on the internet lots of, people talking about taking vitamin D to help, reduce the risk of getting COVID-19. There might be some truth to some of that. Definitely there have been some studies, they're pretty small, but some of the studies do point to having sufficient levels or optimal levels of vitamin D, reducing the severity of the disease. For instance, in New Orleans, they did a study and they saw a correlation. 80% of their patients who had low levels or insufficient levels of vitamin D actually ended up with oxygen support or on the ventilator and in the ICU. 60% of them had levels that were considered almost at deficiency levels. So you want to make sure that your levels are adequate. So what are adequate levels? What does that mean? If you get a vitamin D lab done, you'll look and see that they'll say 30 to 100 nanograms per deciliter is considered within normal limits. If you look at the Institute of Medicine, Vitamin D Society, and the Endocrine Society, they all say 30 nanograms to 40 is considered sufficient. 40 and above is optimal, and too much isn't great because they're starting to see increases of hip fracture. So you really don't want to go over like 80 nanograms per deciliter. But below 30, 20 to 30 is considered insufficient. And then when you get below 20, it's more deficiency. So it is important to make sure you have decent levels. When it comes to athletes, it's actually a good indicator in terms of risk of stress fractures. So a lot of coaches will look and see with their athletes, especially NCAA or the Olympic coaches, to see how their athletes are doing in terms of risk of stress fracture. Also in terms of muscle. So vitamin D is the guy that kind of helps you when you start to fall and you get that kind of catch feel with your muscle. That's the vitamin D working. So where do you get vitamin D? You can get it from the sun. And as you get older, we actually don't synthesize it quite as well. So like in your 50s or above, we're not quite as efficient. Seems to be the case with a lot of things. But you can also get vitamin D that's fortified in cereals, in orange juice. This particular one is not. In milk. And this was just an obvious way. We don't really drink whole milk, but this is a good example. Eggs, so in your egg yolks, is a good source of vitamin D. Salmon is a great source, and then other fatty fishes as well. And of course, the supplement actually helps. This happens to be one that has omega-3 and vitamin D. Typically, I would recommend 2,000 IUs of vitamin D. That's what you see in most of the research to be therapeutic. But have your levels checked and check with your doctor and see how much you need. Hopefully that's helpful for you guys, and I'll see you later.